Hello, everybody. Thank you for joining. My name is Bob Hyatt. I'm a professor of epidemiology and biostatistics at UC San Francisco, and I'll be starting out this session. We're very excited about this project overall, the Upstream Research Center. It's going to be, it's an unusual and exciting and innovative project overall. We're going to be talking about the pilot grants, which were part of it in this information session. I'd like to start out by making some key introductions. First of all, I'd like to recognize Dr. Melissa Bondi, who's going to be one of the PIs of the project. Melissa, would you like to say hello?
No, I want to thank you, Bob, for the introduction, and I'd like to thank everybody for joining us today. And we're hoping to receive some outstanding applications to this RFA, the pilot grant RFA, and I'm just really glad that people are interested. So thank you, and thanks. I want to thank especially the group who put this together, Dr. Hyatt, Dr. Adams, and especially want to thank Leslie Sept and Eileen Barnaby for their work to get this up quickly on our website. And so thanks to all of you for making this happen.
Thank you, Melissa. I think David Rakoff is going to join at some point, but I don't think he's on yet. So I'll go to Elise Adams, Dr. Elise Adams, to just say hello.
Hi, everyone. Thanks so much for joining today. I'm Elise Adams. I'm a professor in the Departments of Health Policy and Epidemiology and Population Health. I am also Associate Director for Cancer Health Equity and Community Engagement for the Stanford Cancer Institute.
And Leslie Sepp, would you introduce yourself?
Hi, I'm Leslie Sept. I'm the Executive Director for the Center for Population Health Sciences and also the Center Manager for this project, which I'm very excited to be a part of. Great.
And Eileen Barnaby?
I'm Eileen Barnaby, the Associate Director for Research Programs with the Center for Population Health Sciences. And I'm also very part of the Development Core, which is part of the pilot grants, and Administrative Core. So it's a pleasure to meet you all, and thanks for joining us.
Great. So we're going to explain about this overall project, but focus on the pilot grants. I can see a lot of familiar faces here. Welcome. We won't go through introducing everybody on the call, of course, but we see you and we have you recorded. I'm going to start out with a couple of slides that give you a little background. Let's have the second slide, Eileen. So as you all know and appreciate, cancer is the second leading cause of mortality in the US, and in places in California, it's number one. The thing that we're concerned about is that the most deprived areas of California have a 19% higher mortality than the least deprived communities. This is an observed disparity of what we believe is an inequity, and we're concerned about how to alleviate these inequities that we observe. We've been given a chance to focus on areas of persistent poverty as defined by the NCI when we responded to their RFA. An area of persistent poverty is one where there's at least 20% of the population in that census tract below 200% of the federal poverty limit for 4 censuses in a row. So this isn't just a temporary situation. These are areas of our state, in our case, that are particularly challenged with poverty. And the challenges of dealing with poverty, or let's call it a social determinant at the individual health system and population level, is what we're dealing with. So we seek to go beyond traditional approaches to behavioral change, focusing on things like tobacco control or diet or physical activity, which are important, but we want to go upstream to address what we believe are the causes of the causes, as the phrase goes. Next slide, Eileen. So the Upstream Research Center will address social determinants of cancer, and we'll focus on income inequality. There are large and other challenges with social determinants, such as education levels, socioeconomic status, food and housing insecurity, social isolation, and other important upstream factors. But we are focusing in our center on income inequality and trying to alleviate some of the impact of that circumstance. So the best evidence we have suggests that key intermediate modifiable determinants of cancer, like tobacco use, diet, high BMI, are likely to be responsive to increases in income. So we're going to see if we can show that. And we have proposed to evaluate the impact of two existing income policies. One of them is the guaranteed basic income, and the other is the earned income tax credit, so-called EITC. Both of these policy interventions are being applied in California. The guaranteed basic income is a new program sponsored by the California Department of Social Services, and they're putting in $35 million to provide basic income to mothers, pregnant mothers, young children, and young adults leaving foster care. And we are interested in the impact of that program. And then the earned income tax credit exists, but it will be increasingly applied. And that gives working families additional tax credits under this program. And so the question is going to be, what are the impacts of those two programs on cancer behaviors and disparities or inequalities? So this evaluation that we're going to provide has multiple aims within the center, including a focus on community collaboration, a key focus on community collaboration, capacity building within both the research enterprise and communities, career development, and a pilot research program, which is what we're talking about today. And this program is to seed innovative and sustained strategies that we think will help in alleviating persistent poverty. So we're going to tell you about the pilot program and how it's used, and we hope that you're interested in applying to it. Again, we're very excited about this overall project. Thank you for your interest. I'll turn this over now to Dr. Adams.
Thanks so much for that wonderful introduction of this amazing, amazing initiative. As part of our mission to reduce the cancer burden in persistent poverty areas in Northern California, the Upstream Research Center is launching a new pilot program, as Bob mentioned, to facilitate partnerships with new investigators and community partners that will produce data that can enhance the work of the Upstream Research Center and serve as a basis for expanding research support with external peer-reviewed grants. Next slide, please. Our goal is to catalyze novel and collaborative research that enhances the work of the center and facilitates partnerships with these investigators and community partners. The center is currently seeking proposals for 3 distinct but related tracks. The first is community partners, the second is pathways and policy, and the third is early career. I will go through each of these shortly, but I would say that the awards will be granted for up to 1 year and up to about $75,000 in direct costs. Community prioritize interventions, research, and capacity development projects related to social determinants of cancer to achieve cancer equity are really the focus of these particular community partner pilots, and intervention ideas for pilots are encouraged. The requirements are that the pilot will include plans to increase the capacity of researchers and community partners in community engaged research, and we will require a brief letter of support from the identified community collaborator describing their role on the project, their compensation, and their plan to disseminate key findings back to the community. Those eligible for these projects will include community organizations in Stanford, UC Davis, and UCSF PI eligible faculty. And I would encourage all of you, as I describe these, to go ahead and put your questions in the chat. We will be answering questions at the end of this process of introducing the pilot opportunities. So please do put your questions in the chat, and we will get to those shortly. In terms of the topics for these community partner ideas or pilots, our upstream community partners have already identified a few topic areas for consideration. We've listed some here. I'm not going to go through all of them, but they include things like understanding the relationships between biological mechanisms, behavioral risk factors, poverty policy, and cancer inequities among people living in these areas. They also include understanding and addressing the impact of climate change on cancer inequities in persistent poverty areas. Finally, they also include things like how to co-design and evaluate programs and interventions aimed at reducing cancer inequities in these areas. This list is not intended to be comprehensive, and topics not listed here are very well encouraged and to be applied for. And they should be, however, in direct response to community needs around persistent poverty areas. And we appreciate your attention to this particular pilot. The next pilot opportunity is called the Pathways and Policy Track. This particular pilot opportunity will support projects that can elucidate the mechanisms and pathways linking programs that address social determinants of cancer, including the basic income experiments, housing and food insecurity interventions, as well as structural racism, to how they affect cancer health inequities and thereby support policy change. Requirements for this particular pilot program include a plan to identify and engage relevant policymakers in the process. We also are looking for a plan to promote cross-institutional collaboration among Stanford, UCSF, UC Davis, as well as across disciplines within the same institution. Eligibility criteria include that you must be Stanford, UCD, or UCSF faculty with PI eligibility, as well as postdoctoral scholars. Postdoctoral scholars are required to have a PI eligible mentor on these projects. The Upstream Center is also facilitating the training and career development of early career scholars who are committed to advancing cancer health equity through research and practice in persistent poverty areas. The research thought through this particular pilot mechanism will address upstream social determinants of cancer and their links to biopsychosocial mechanisms and behaviors that can lead to cancer, such as income inequality, social isolation, as well as other factors that are associated with cancer risk factors, such as tobacco and alcohol use, sun exposure, and access to preventive vaccinations, as well as early detection. Early career applicants may link their pilot to a career training program broadly in the field of persistent poverty. They also have the option of engaging in the center's 2 research projects. Pilots in these areas must also support the career training and activities of may also support postdoctoral scholars in the Upstream Research Cancer Career Enhancement Core. As a requirement, we need a plan to link the pilot to a career training program broadly in the field of persistent poverty research, and a plan to promote cross-institutional collaboration as stated previously, or cross-disciplinary activities. Eligibility criteria include a Stanford, UCD, or UCSF postdoctoral scholar with at least 1 year remaining in their fellowship. Postdoctoral scholars may serve as co-PI or co-investigator, but are required to include a PI-eligible faculty member as lead PI on the application. Now, the evaluation for these tracks is somewhat similar. We'll be looking at quality. In particular, they must advance research in the intersection of persistent poverty and cancer control and meet high standards for scientific rigor and innovation. They must also be relevant to the mission of the Cancer Center. Proposals will be judged on how well they synergize with the center's research projects and the overall mission. Reviewers will be asked to evaluate the qualifications of the PI and key personnel and whether the proposal promotes cross-center and cross-network collaborations. Community engagement is also a key criteria in which we will ask how well the proposal encourages active engagement of community partners in all stages of the research, from the development of the ideas to publication and through to dissemination. Finally, the proposed research must be completed within the project period and within the budget limit. Please note that there are some additional criteria as it relates to the community partner pilots. In particular, these grants must be responsive and relevant to community partner priorities. The proposal should demonstrate a detailed understanding of the community partners' priorities, describing how the project will facilitate the advancement of these goals. Second, they must be capacity building. Specifically, the proposed research should strengthen bidirectional relationships between the center's researchers and community partners, and build the research and data capacity of both institutional and community partners in community engaged research. This needs to be reflected in the budget, demonstrating an equitable allocation of resources between community partners and researchers. In terms of the application requirements, we require a cover sheet and a research plan that will include specific aims, specifically a one-page justification that includes the aims, general methods, and defines and explains the persistent poverty census tract area needs for cancer control, particularly in low-income and underserved populations, and what research gap this project would address. Interventions specifically should include a description of how implementation will be evaluated. We'll also need to include in that research plan a description of the research partnerships, including the different types of partners, as well as justification for their involvement. We also want you to describe background, a background statement on any relevant existing services or resources offered at the cancer centers and your respective institutions, and any staff expertise for the expansion or integration of any new program for this effort. So really that synergy with cancer center resources. We'll also be looking for, again, community participation, describing the processes that lead staff members lead staff members will use to identify the appropriate framework and to incorporate strategies to elicit input from and address cancer control needs of the clinics and or communities they serve. We also want you to outline a work plan that provides a timeline for development and or implementation of the research, which should include milestones for tracking the progress of the work. Awardees will be required to present their work in progress to the Upstream Regional Community Advisory Board twice during the 12-month project period. Finally, project leads will need to include a statement of the qualifications for the intended leads of the program. Additional components will include a statement of relevance to the overall aims, again, a community engagement plan, which will be half a page, a modular budget and budget justification, an NIH biosketch for the PI and key personnel, again, the letters of support that we mentioned previously, and any additional letters of support that are necessary for even given application, and protection of human subjects documents. For human subjects research, project investigators and their research staff must complete the usual training, the city training, and all approvals are required before funding can be dispersed. In terms of the awards themselves, they will be granted for 1 year and for up to $75,000 in direct costs. This can be used for personnel, travel, materials, supplies, and other research expenses. All unexpended funds will be forfeited if not spent within that awarded project period. We anticipate making 3 awards, 1 per track. At least 1 award will support an intervention study. And I can't emphasize enough, because this is not under our control. This is by edict of the funder, that unexpended funds will be forfeited if not spent within that 12-month period. So your projects should reflect the ability to not only start, but complete the projects within 12 months. At this point, we really invite your questions about this project. Please put them in the chat and or raise your hands. And thank you so much for your attention today.
Elise, it looks like, I'm not sure if I'm pronouncing your name correctly, but Nita has raised her hand with a question.
Thank you. Please go ahead, Nita.
Thank you. My name is Nita Mokand. I am a postdoc at UCSF, and I would love to learn more about the guaranteed basic income programs. Specifically, when will the guaranteed basic incomes begin distribution and finish distribution for young adults leaving foster care? And how will eligibility be determined for the universal basic income?
I can help to, I think, answer that question. So we're working with the California Department of Social Services right now, kind of talking about when it would be implemented. They haven't finalized it yet, but the good news is that it has not started. So, and then in terms of the length, what we were told is that it's going to vary. So for some organizations, it's going to be 12 months. And for some organizations, it's going to be 18 months.
Thank you. Oh, regarding the eligibility, will all young adults who are leaving foster care be eligible for this program or receive it automatically? Is there an application required?
Yeah, I'm not as familiar with those details, but and this is not going to quite answer your question, but they awarded the 7 different organizations, and for those that are focused on foster care, kids that are aging out of the system, my understanding is they would be randomly assigned to receive the income or not receive the income. And I think it's whoever expresses the interest in being part of this study. And also, like, I'm happy to connect you with the PIs if you have additional questions as well.
So let me just add a little bit to that. Since we're working with the state, we're going to be getting access through them to have access to the data and asking questions. But in terms of the actual conducting these basic income programs, it's through the community groups that were awarded funding from the state. We have nothing to do with that part of it and the requirements for who gets access to that. We're just the recipients of the data and trying to ask questions related to how the cancer prevention activities that they might have, and trying to learn more about behaviors in that population that could be associated with them having more income. And so that's in terms of that project, we're working with them. We're not part of any of those decisions about who gets access to those funds and how those are being allocated.
Thank you for.
I hope that answers your question.
Yes.
Did we, there were some questions in the chat from Michelle. I think you may have answered that.
I think I'm
Okay.
answering them as they come in, but if I miss
Okay.
one, please, anyone, or if you need a correction, correct me, please do.
So let me add a couple of things, because the slides and the capture of this session will be added to our website, so people have access if you know anybody who's missed it, so they'll have access to the information.
I think it should be emphasized too that the website has a lot more detail about the project, the main projects behind the well, not behind, but the main 2 projects that are the basis of the work we're doing. And so the kinds of things we're looking for in the pilots are ways to help us assess the impact of income supplementation on the populations in these areas. So you'll see from looking at the overall description that we plan surveys, and we plan to use the BRFIS and NHIS surveys to look for change, but there may be other ways too that you all might come up with that would be interesting for us to evaluate. This is an interesting project overall, because this isn't the normal sort of a randomized controlled study or observational study that you all may be used to, but rather how do you think about the impact of something that's really in the social determinants realm, as we have given examples of, and how does that affect cancer-related behaviors and carcinogenesis? Those are really open questions in the field, and we'd like to encourage pilots to think about those kind of connections. Well, either we've answered a lot of the questions by our presentation, or everybody's very shy. So Any other questions? The proposal is very short. It's only 3 pages, really. So although we realize and apologize in a way that we have to ask you to submit a proposal by August 28th, not by very much time, it is very short. And so most of the work that you need to do is getting your ideas down on paper and getting the appropriate community or relevant community folks to work with you in a collaborative way. But the process is fairly short. We think the money is generous. I guess the other thing we could say pretty safely is that this is the first round of pilot studies, and there'll be other pilot studies over the 5 years of the project. So there'll be other opportunities to elaborate on your ideas.
I can answer that. You can, if you have questions, you're more than welcome to reach out to me. Eileen will put, I think we have a central email address that Eileen can chat to folks. But I'm happy to talk to anybody and make sure and connect you with the right people. Also, we're hosting office hours on the, I think it's the 11th and the 18th. Is that right, Eileen? Did I remember correctly? Yes. You know, and I would add too, like, we're not just here to answer questions, but you know, I'm personally happy to help. Like if you're like, oh, I have this great idea, but I don't have a partner, you know, I can certainly like suggest people that you could potentially reach out to. You know, also like our team has a lot of data expertise. So you have those kind of questions, we can help too. So.
And one other thing that Dr. Adams mentioned that I'll like to emphasize is that we're looking for ideas that make use of the collaboration between our 3 institutions. This overall grant is being led by Stanford, but we have a very close relationship. A lot of us know each other and we've worked with each other before. Melissa Bondi and I have known each other and worked with each other for what, 30 years. But let's not go into that. I see a question from Aaron von Blerigan. Aaron.
Yeah, I have a question about track 2. It sounds like for that track, do you have to be evaluated? Like, I guess when I first read it, I was thinking potentially a project that would be focused on the pathway, like something related to my area, like food insecurity, could still be applicable, but does it have to be addressing a policy? Or could you potentially, for example, be doing an individual level food insecurity pilot?
I personally think an individual level pilot would work if you couch it in terms of its use, the use of those results for generating a program or a policy. So policy can be, in my view, big P or little p policy. That is, big P policy is legislation or guidelines. Little p policy is something that you might institute at a community level or within an institution as a programmatic innovation.
Okay, great. Thank you.
Yeah. Other questions?
I just want to add that I think, you know, this is a pretty novel concept. I, for one, have never sort of been involved in the development of a pilot program with 3 different sort of arms. So I know you probably need to digest some of the information that you've received today, but I really hope you will reach out to us if you have questions. It's our goal to get really successful applications in. So we're here to help if you have additional questions or thoughts about ways in which your research might intersect with this work. Erin, did you have a follow-up question?
Yeah, just a small one. And can you submit like MPI type, or do you want a single PI specified? Does it matter?
I personally don't think we haven't really discussed that too much, but you know, it's a small grant. Aaron, and the more PIs you put in there, the less support they're going to have individually. But yeah, if you've got 2 or 3 other colleagues you want to have to co-lead it, there's no exclusion around that.
Okay, thanks.
Melissa, did you have a question?
Yeah, I just want to say, yeah, actually a comment, and we encourage, as Bob said, if you had other collaborations at any of the other centers, I mean, we welcome that. But I want to thank everybody for coming, but also the NCI is really interested in what we're doing, and they're very involved in this whole program with us. So just to mention what we're doing has a high priority for at that level. So I just wanted people to know we want great submissions, and they're going to be also reviewing whatever we think is fundable in our center with the other there's 5 centers total that are part of this initiative, and so we'll all be seeing the kinds of things that people are submitting, and they at other centers, and so this really has a high impact nationally of what we're doing, and so I just wanted to mention that.
And to add to that, on our website, you'll see 3 news releases or 3 URLs. The first one is actually how it was originally announced from the White House. So President Biden and Vice President Harris both wanted to be the ones to announce this, which will give you an indication of their interest in the overall project.
I see a good question in the comments, in the chat. So the question is for the community partners track, are you looking for the community organization to lead this or to serve as a partner to the NCI team?
Great question. Thanks so much, Julie. And please do speak up if we don't answer your question. So because of for administrative purposes, we do need a university PI to be a PI on the project. However, for the community partners track in particular, we certainly hope that the community partner will actually be one of the leads of the project in the terms of setting priorities, defining what the research question should be, and what the outcome and certainly dissemination of that work would be. So through beginning to end. And so that means we expect to see them in the budget. We expect them to see them in leadership roles. And we expect to see demonstration of proof of that through a letter of intent, for example, or a letter of support from the community partners. So while administratively we can't have them be sort of the contact PI, we certainly hope that they will serve in a co-PI role with the university partner in that. But let me pause and see if Leslie or Bob have anything to add or to make sure that we've answered your question, Julie.
I think you've covered it, Elise. It's our intent that the community partner have a major lead in the project. So in terms of the actual work and thinking, we would like the community partner to be a definite lead. It's only for administrative purposes that we have to have a institutional PI involved. The level of involvement of a community person could determine how they get paid. So if it's a minor role, there might be, they might be paid as a vendor. If it's a major role, it could be a contractual relationship. But we're open to all levels of involvement by community folks.
Yeah, and I would encourage community organizations to definitely reach out to us during the application process, because we can explain more about the administrative side, and we can also help with that. And I see Michelle has raised her hand.
Can I just add one friendly amendment to what Bob had just said as well, Leslie, in terms of that Julie's question, and that is that while for administrative purposes, we do need a university PI, I want to emphasize that does not mean that the university PI is in name only. We really do want this to be a partnership where and no one was indicating that, but I wanted to sort of emphasize this. This is a partnership, right, between the scientists and the community partners. So it's not sort of a in name only university PI and the university and the community partners doing their own thing. We really hope that they will leverage the resources that we have in these universities to accomplish their goals, and that the PIs will learn from the community partners about how these things work in practice on the ground, right? So we really are looking for bidirectional partnerships here, not one leading the other necessarily, but really sort of working together, and certainly the community needs as being at forefront for everyone involved.
Yep.
Thank you for that question.
Michelle, go ahead.
I wanted to ask a question about track 2 related to the policy and whether or not it's specifically focused on social policies and not healthcare policies. For example, if I were interested in examining Medicaid benefit designs in these different high poverty communities and or other determinants of access to care, would that be considered responsive to the RFA?
Yes, and please, Michelle.
Medicaid is a social program. So I don't want to cut anybody off, but at some point here, if there are no more questions, we will conclude the information session. Going once, going twice.
Sorry, I have a quick
Thanks,
question. I
Oh,
joined
okay,
the
good.
meeting late. No, I joined the meeting late. How do we get the recording of this meeting? Will that be sent to all the registrants?
Yes, it will.
Yes.
be.
Okay, thank you so much.
Going once, going twice, going 3 times. Thank you all very much
Thanks.
for joining.
Thank you.
Spread the word around. We're looking for some good proposals. Bye-bye.
Bye.